Hi, today we're going to talk about one of my patients, Daniel, who came here for different types of reasons, and I'm going to let him explain, but we kind of worked with him to improve his digestion and to clear out some symptoms. Daniel, thanks for sharing your testimony with us today. I wanted to have you just kind of discuss over the last 4 years or so, what happened, what problems did you have, with your skin and your digestion system?
Well, Mom treated me on new pharmacy medicines.
For your acne?
Yeah.
And how long did you take those? Do you remember?
Probably 2000. I'm not sure what year
sure.
though.
Okay.
Yeah.
Susie, do you remember how long he would take the antibiotics?
He was on antibiotics about maybe 2 years and a half straight.
2.5 years, and that was to clear up his acne?
Exactly. He had
Okay.
cystic acne.
And what was the effect of taking the antibiotics?
At first, it cleared his acne, and then afterwards, it didn't work. So we would go back with the dermatologist and ask. She says, "Well, just continue using it and using the creams. Remember the creams that she gave you for your topical creams for his face, and just continue using the antibiotic." So we did this. We did it because we thought it would help Daniel because of his diagnosis with his with his skin.
What happened to the digestive system as a result of the antibiotics?
He started having, what kind of problems were you having, Daniel?
Acid reflux, heartburn, chest pain. I'm not sure about the blue neck.
But what were you doing a lot?
With your throat and the mouth?
Burping. Remember burping a lot?
Gastritis.
Gastritis and stuff.
He felt very bloated, extremely bloated, couldn't digest. He was complaining that he felt that the food was just coming up his throat and he was spitting it out.
And pressure.
Tremendous pressure in his throat.
And then we had a difficulty where about a year or so ago he went to UCLA Medical Center.
To be treated.
And what was that for?
He was having problems with anorexia and bulimia at the time.
And also suffering from digestive problems.
Oh, definitely.
Yeah.
So what did they do at UCLA?
They pretty much, what did they do, Daniel?
Every meals they passed out the medications, and even if we finish the meals, like they just give us like 2 cups of waters, and later just give us the medications.
Okay, and some of the medications were like antidepressants. Is that right?
Definitely.
And then some of the medications were sleeping pills.
Yes.
Yeah.
And then there was medications for the stomach.
Yes.
Okay, so you went there for approximately how long?
A month.
Right.
About a month. Okay. Now, did things get better or worse, or what happened?
Well,
The goal was to gain weight because he was anorexic and he was weighing 93 pounds. Weren't you, Daniel? 93 pounds.
I'm not sure, but they first dropped our weights to begin with, like before moving on to the next how much calories you need.
They watch your calories and made sure that you ate. They would watch you eat your meal, and they gave you a certain time to eat it.
So after taking the medications like Paxil, was there any problems that occurred?
That I'm not sure I remember.
Okay.
They were monitored for 24/7. They could not go into their room And so to make sure that they didn't keep the pill under their tongue or
right.
anything like that.
Mhm.
But after a month, Daniel was put in 5150 because he just, things got out of control.
Yeah, it got cloudy, and the antidepressants have a lot to do with that. I've had several patients that were hooked on that, and they had 5150 holds on them. So I kind of started treating you for the digestive system, right? And what do you remember starting out here? What did I do?
Checking the for really tight knots. I mean
In the spine?
spine, and also the stomach, that which I have problem.
Mm-hmm. Switch over to the diet.
Yeah.
We worked with also the meridians. We strengthen the meridians, and we also give you a specific blood type diet too. And how do you feel today, or how can you eat food? How do you feel day to day?
I feel okay just eating.
Mhm.
But even under anorexic though, like you told me, finish the meal until you feel full.
Yeah. So
Daniel's doing much better.
Mhm.
Definitely. He's gained weight. He feels good. He's enjoying his food. His symptoms with the changes of medication that you've done for him, it has the acid reflux has calmed down tremendously. He's able to digest. He's able to have regular bowel movements. All the way around, 90-degree change has been definitely a blessing.
Good. And I've seen a lot of change too. I mean, just strength-wise, you're a lot stronger. This is important for people that don't know where to turn. The medicines are not the answer. The surgeries are not the answer. The only true answer is always healing naturally.